It's now time to throw everything at the COVID emergency. That's Gladys Berejiklian's message more than 9 weeks after it began. So even stricter rules are on the way. They include a curfew in Sydney's hotspots. Across the state, masks must be worn outdoors. Another 644 people have the virus. 4 more families are grieving. 2 of the deaths were patients exposed in hospitals. The total number of infections has soared past 10,000, and this wave has now claimed more lives than every other outbreak in the state combined. The Cumberland area is one of the hardest hit. The vast majority of new cases are in councils of concern, but some who live there are furious about these changes. We have reporters in key locations tonight, plus political analysis. Cayman Gok in Sydney begins our coverage.
For weeks, the Premier's resisted calls for a Melbourne-style curfew.
The facts are that will not change the dial.
You rule out curfews?
Look, they haven't demonstrated they work. If we thought that they would have a significant or even marginal impact, of course we'd do those things. But there is no evidence to suggest that's the case.
But with daily cases again in the 600s, Gladys Berejiklian has changed her tune.
We will be implementing curfews in those local government areas of concern from Monday.
Meaning most can't leave home at night.
The 2 weeks that was locked down in the beginning, should have done it then.
Curfew, everybody will be upset, very upset. It's not freedom at all then.
Exercise has been slashed to 1 hour a day. And office suppliers, nurseries and hardware stores must move to the click and collect model.
Come Monday, we're well set up to support our customers online, as we have been.
These tough new rules only apply to the dozen councils of concern. They're now home to 85% of new cases. Cumberland and Canterbury Bankstown are the worst affected. Both have more than 100 new infections.
Do I wish that I raised curfews day one? Yeah, probably, but you probably would have laughed me out.
People are going to be very angry when they see images of people walking along the beach in the eastern suburbs after dark, but they can't even take a foot off their driveway after 9 o'clock at night. If we're going to have a curfew, then it should be for all of Sydney.
In a week's time, authorised workers coming and going from the hotspots will need a permit.
We would like to avoid the curfew, but I think we're now at a stage where people need to think about how their behaviour is affecting the greater community.
There is a new rule that will apply to everybody in New South Wales, no matter where you live. From Monday, whenever you leave the home, you must wear a mask outdoors. The only time you can take it off is when you're doing exercise.
We have thrown everything at this. Now, whilst
everyone's saying
whilst
why
the
did
evidence,
you throw everything at it?
Whilst the evidence of curfews is mixed, the evidence to a lot of this thing is mixed. But I don't want us to ever look back and say we didn't try, we didn't put everything into this.
It might take everything and the kitchen sink to start turning these numbers around. Cayman Gok, ABC News, Sydney.
So let's take a close look at some of the changes. Sydney's lockdown is being extended to the end of September, but the Central Coast and Shell Harbour will now be treated as regional locations instead of part of Greater Sydney. And from midnight, if you want to travel more than 50 kilometres from the Sydney metro area, you'll need a permit. In the city's dozen hotspots, the curfew will be enforced from 9 o'clock at night to 5 in the morning, and that means from Monday you'll only be able to leave your home if you're an authorised worker or you need medical treatment or there's an emergency. There are also big changes on the way for healthcare, childcare and disability support workers. Everyone in those professions must get vaccinated. We have reporters in 2 of the hotspots tonight. First is Cecilia Connell in Canterbury. Cecilia, testing requirements are changing yet again.
Jeremy, testing clinics like this one have been swamped. There's been long lines and people have been waiting days for their results. But surveillance testing will no longer be required in some suburbs. That's to prioritise people who have symptoms. Instead, authorised workers who live in the hotspots will need to take a rapid antigen test if their job is outside their LGA. Businesses have been telling me that they support the move, but they want to know how it will impact smaller operators, and they've been asking who will pay for it. Jeremy.
Cecilia, thank you. Cayman Gock is still with us in Auburn. Cayman, police are also getting extra powers.
Jeremy, police will not only be able to fine someone for leaving their council area without a reasonable excuse, but can now also order them to return home and isolate for 14 days. Officers can now lock down apartment complexes and homes if they're deemed COVID hotspots. Now, we saw police ramp up their efforts on the motorways this afternoon, setting up checkpoints and stopping people travelling to the regions. So far, 3,500 infringement notices have been handed out this week, and nearly 1,500 officers will be out and about tomorrow, prepared to disrupt a potential another lockdown protest. A 29-year-old man who travelled from Queensland to take part was today sentenced for at least 3 months behind bars for helping organise this unlawful event. Jeremy?
Cayman Gock and Cecilia Connell reporting. Well, some of today's announcements are a major backflip for Gladys Berejiklian. State political reporter Ashley Raper is with me now. Ashley, the Premier has spent the past 8 weeks saying some of these measures were just not necessary. So why the change of tune now?
It did seem a surprising move, Jeremy, because just days ago the Premier was adamant that the rules in place were adequate, and she has repeatedly rebuffed suggestions that a curfew was necessary. But behind the scenes on Wednesday, the day cases entered the 600s, Crisis Cabinet decided that things could not go on as they were. So it gave police and the public health team 24 hours to go away and work out what extra measures could be brought in. And the ABC understands that almost everything they put forward was agreed to by Crisis Cabinet at a meeting last night before the Premier announced it this morning. From a political point of view, the government has now limited the criticism that this lockdown isn't tough enough. But on the flip side, the government now looks reactive and it exposes it, and the Premier in particular, to other criticisms, like why was this not done weeks ago? And now, Jeremy, we have yet another version of this lockdown and at least another month to go.
Ashley Raper, thank you. Well, the situation's also getting worse in Western New South Wales, but help has arrived. Lani Otway is live for us in Dubbo. Lani, getting vaccinated is about to get a little bit easier.
Jeremy, a mass vaccination hub set up by the Australian Defence Force will be opening here tomorrow at 9 a.m. Anyone can walk in without a booking for a Pfizer or AstraZeneca shot. The ADF will then be travelling to 33 communities over the next 8 weeks and says it wants to support everyone, especially Aboriginal people.
We've got the oldest enduring culture in this country. It's something that we all hold very dear. It's something that makes us unique as Australians, and consequently it deserves protection.
More towns in the west and far west have been affected, as Gary John Lysart reports.
Luke Driscoll is getting into full PPE so he can pick up a Wilcannia resident for a COVID-19 test. Dispatched by a support service in Broken Hill, he's also organising meals for locals, fearing the consequences if the virus takes hold.
It's a small community and everybody here is super important, and the health system wouldn't be able to cope.
Another 3 cases have been discovered in Wilcannia and 2 in Broken Hill. Across the Western Health District, there are 27 new infections. Most are in Dubbo, but Burke, Gilgandra and the small town of Gadooga are also affected.
We're so far away from everything. We don't have the resources available like some of the cities or, the bigger regional towns.
Health officials say no one should be under any illusions about the seriousness of the situation.
With COVID spreading across nearly every community in our region, we know it's out there. We know that it could be your neighbour, you or your kids.
And sewage surveillance is raising the alarm elsewhere.
Our concerns are in areas of Cobar, Port Macquarie, Parkes and Canamble.
From midnight, Sydney siders travelling to regional areas must apply for a permit.
It's an offence now to leave Greater Sydney to go to regional New South Wales without a reasonable excuse.
The vaccine rollout might be ramping up, but some believe it's still poorly coordinated.
Get a national plan organised. There isn't one.
Health authorities here in Burke are still struggling with vaccine hesitancy among the Aboriginal community. They're trying to ease people's concerns by going door to door.
Come in, get vaccinated, it's so important, and let's look after our family and our mob.
hoping to earn people's trust before it's too late. Gary John Lysart, ABC News, Bourke.
Further north, there's been mayhem on the Queensland border as locals scramble to get a shot. Leah White is in Tweed Heads. Leah, why the rush?
Jeremy, essential workers will need at least one dose to enter Queensland from tomorrow. For some, it's been incredibly frustrating. They say they haven't been given enough time to get the jab. There's been a steady stream of mostly young people here in Tweed Heads desperately trying to get vaccinated. A local GP says preparing for the new rule has been a logistical nightmare.
We've been given about a 3-day window here to try and get that working community vaccinated. It's just impossible. The human resources involved in vaccinating everyone before the border changes, it's unmanageable.
The Queensland Government has also shortened the list of people who can apply for a border permit. Teachers, childcare and hospitality workers have all been excluded.
Leah White reporting.